So my name is Remi Buisson, and I'm an assistant professor at the University of California, Irvine. And the current project of this proposal is about APOBEC3A expression in cancer and how it affects cancer development. Currently, I'm studying this family of protein called APOBEC that cause DNA damage and mutation in many types of cancer. What we know about APOBEC proteins, usually they are important to protect our cells against a virus infection, so they are not expressed in our cells, but when the cells is attacked by a virus, the cells start to express this protein, and the expression of APOBEC going to target the genome of virus and stop the replication of virus. So, however, cancer cells deregulate this pathway in order to now overexpress this protein, and they're going to now attack our own DNA and cause mutation. And that's very good for cancer cells because that's a way for accumulate mutation and promoting increase cancer progression, drug resistance, and metastasis. Our normal cells do not express APOBEC3A, and so we can develop a therapeutic strategy to only target cancer cells that express APOBEC3A or the type of APOBEC without to target our own cells. And that's a strong advantage because we know that now the new treatments, we try to only target cancer cells and not target our normal cells to decrease the toxicity. And so that's a strong advantage to target cancer cells that express APOBEC proteins. We know very well now that when a tumor, like within the same tumor, all the cells are very different. And that's a strong advantage for the tumor because now if we treat the tumor with drugs, many cells are going to die from this drug, but some of them are going to be resistant. And this cell is going to take over the tumor, and that's usually the one that kills the patient. And so it's very important for us to understand how the tumor develops this heterogeneity across inside the tumor. And APOBEC is one of the processes that leads to this heterogeneity because cancer cells are going to express APOBEC3A, for example, and accumulate randomly mutation in their genome. So every cell going to start to accumulate different mutations. And so now when we treat the cell with a drug, many of them are going to die, but some of them that accumulate the good mutation going to become resistant. This is why APOBEC3A expression is so important for the cancer cell in order to develop this heterogeneity that will lead later to cancer resistance. And this is why in the lab we are interested to understand how we can suppress APOBEC3A expression to prevent this accumulation of random mutation in the cancer genome that will lead to this heterogeneity and leads to the resistance of some of these cancer cells. So this is why it's very important to try to avoid as much as possible the heterogeneity within the same tumor. So like that, all the cells are going to die to the treatment and and we don't want to have some of the cells that are becoming resistant to the treatments. Our cells develop many different DNA repair process in order to prevent as much as possible APOBEC caused mutation damage. And unfortunately, most of this mutation, most of the damage caused by APOBEC are going to be repaired correctly. But like any mechanisms, it's going to have some error. And this is why over time, we start to see the accumulation of mutation. And we know also that many type of cancer, such like breast cancer, for example, are defective in DNA repair mechanisms. It's very well known, for example, for the BRCA pathway that is important to repair a DNA double strand break. And APOBEC has been shown to cause DNA double strand break. And this is why maybe mutation caused by APOBEC3 are so common in breast cancer because many breast cancer cells are defective for some of the DNA repair mechanisms that go into repair this damage caused by APOBEC. And so that's maybe one of the explanations why it's so common to see patients with APOBEC mutation in breast cancer. And we are trying to understand that in the lab. We don't have the full answer yet, but we think that there is a connection between BRCA deficient cells and APOBEC mutations. this. So this project really, we wanted to try to understand how cancer cell use the normal regulatory mechanisms to express APOBEC proteins in order to now use them in their advantage. And that's really the main goal of this project, is really to try to understand how cancer cell deregulate all the normal process in order to express APOBEC proteins and cause mutations. And the long term of this project is really to try to identify a strategy, therapeutic strategy, in order to prevent cancer cells to deregulate this pathway and to suppress the expression of APOBEC3A and other APOBEC in cancer in order to inhibit the accumulation of mutations caused by the expression of this protein. Yes, so APOBEC3A expression has been found in many types of cancer now. It's especially a breast cancer. We know also in bladder cancer, cervical cancer, head and neck, lung, and many other ones too, but that's the main one. And in this type of cancer, up to 80% of patients overexpress APOBEC3A, or we were able to detect mutation caused by APOBEC3A expression in this case. So it seems that it's something very, very common, and this why it's become important to try to understand how can this cancer type regulate APOBEC3A and how we can suppress in this type of cancer. And so it's not a subpopulation of a subtype of cancer. It's something that it's very common. So everything we can find we will be able to apply to many types of cancer too. So it may help a lot of patients for this reason.